Welcome back. It is not news that we are experiencing a pandemic of the unvaccinated and that our political divide plays a pretty big role in who is being infected. But now we have a stark illustration of this issue. This is a list that we put together of 30 counties with the highest infection rates in the country, starting with the highest. As of yesterday afternoon, every county with one exception voted for President Trump. And most of these counties voted for him by 40 points or more. And when you look at where these counties are, you can see that this fourth wave of COVID has a distinctly southern flavor, at least for now. Nationally, the 7-day average of new cases is now nearly 154,000. That is the highest since late January. So joining me now is Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press.
Thank you, Chuck. Thank you for having me.
I want to start with the question of the third shot, booster shot, however you want to reference it. There's on Friday, in the fog of Afghanistan, if you will, there was some confusion about 5 months versus 8 months. Here's what the president said, and then Jen Psaki right after.
The question raised is, should it be shorter than 8 months? Or should it be as little as 5 months? And that's being discussed. I spoke with Dr. Fauci this morning about that.
Let me be very clear. The president would rely on any guidance by the CDC and the FDA and his health and medical experts. That guidance continues to be 8 months. That has not changed.
Now, the president was meeting with the prime minister of Israel, and we know there's a lot of research that's come out of Israel about this third shot, and they have seen already have sort of turned around their morbidity rate with the third shot, they believe. What is happening here between 5 months and 8 months?
Well, we're still planning on 8 months. That was the calculation we made. This rollout will start on the week of September the 20th. But as we've said all along, Chuck, in the original statement, that's the plan that we have. But we are open to data as they come in. This will have to go through the FDA process and then the Advisory Committee on Immunization Practices that advises the CDC. So right now we're sticking with 8, but we're totally open to any variation in that based on the data.
Where did the 8 months come from? Because it seemed like all the clinical data, the trial data was based on 6 months, not 8. And the only way I got to 8 was, well, the WHO asked for a 2-month moratorium because they're worried about the global vaccine supply. Where did we get 8 months?
No. Well, certainly it was nothing to do with the WHO's moratorium on boosters. That wasn't even in the consideration. Mm-hmm. As the data accumulated with our own cohorts, Chuck, from the CDC, as we were looking at it, was only in mid to late July that it became very, very clear that we were starting to see a diminution of waning of protection against infection and the slightest hint, if any, of waning of protection for hospitalization and death. So it was at that point that we decided we're going to plan to go at the feasible time in September, the week of September the 20th, to start rolling it out. And that's where we got with the 8. As I said, we're sticking with that for now. We're not changing it, but we are very open to new data as it comes in. We're going to be very flexible about it.
Dr. Peter Hotez told me the other day that he thought that one of the things we didn't do very well, when he says we, the collective we of messaging on the vaccines, was he said, you know, this was probably always going to be a 3-dose vaccine, that many of our vaccines are 3-dose vaccines. But this one is a little different because the second dose we decided to do so quickly. Do you concur with that opinion?
Oh, I think that Peter Hotez is right on the money. We were dealing, Chuck, with a total emergency situation. If we had the grace to be able to do this in a very slow, measured manner, the phase 2 study would have given various intervals of dosing. It is entirely conceivable that when all is said and done, the standard regimen will be a 3-dose shot for the mRNA and a 2-dose shot for J&J. But if you go back when we were doing this, we were really fighting against time. We were having to save lives, and we needed to do it very quickly. So I don't think there was anything errant or wrong in the way we started it with 2 doses, but at least now we're being very open and flexible that we may need that 3rd dose. In fact, I'm certain we're going to need that 3rd dose looking at the data that we've seen.
I want to talk about sort of where we are in this fourth wave. School has been essentially open now in some of the country for almost as long as a month. Cases among children have doubled basically since the start of August to 20 days in. Over a 19-day period, we saw cases in children double. With basically the rest of the country starting school essentially this coming week, where do you see this wave going, and are we headed for basically more increases in cases as school and this virus circulates?
Well, that's possible, Chuck, but I believe we can avoid it. I mean, you can avoid it by protecting the children. We want to get them back in the classroom. I mean, we've been through that now for a while, that the deleterious effects of keeping kids physically out of the class regarding psychological, mental, and social development. But we want to do it safely. And there is a safe way to do that. You surround the children with people who are eligible to be vaccinated and who get vaccinated. Teachers, school personnel, the students from 12 and older who are eligible to be vaccinated right now, to get them vaccinated, and then abide by the CDC recommendations of having masks in the school and do other things to mitigate. And that could be ventilation, that could be testing, that could be a number of things. We understand the risk, but we want to safely get the children back in school. And I believe it can be done. But as you know, there's a lot of issues there. Yep. When you try to get mandating of masks, there's pushback from certain authorities, which I feel is really unfortunate because it's going to really endanger the health of the children when we do that.
You made a comment earlier this week that you thought we could have some return to normalcy by spring of 22. In the winter of 20, you thought maybe we could get there by the spring of 21, or maybe by the end of the summer of 21. Look, we know all of this has been dependent on folks getting vaccinated. But are we past the point of defeating this pandemic? Are we now, is it now an endemic, and we're going to have to just all learn to live with it?
Well, in some respects, yes, but mostly no. And let me tell you why I say no, Chuck. Because we have within our power the wherewithal to really suppress this outbreak, at least in the United States. We want to do it globally, and we're playing an important role in that. But with regard to the United States, we still have about 80 million people who are eligible to be vaccinated who are not vaccinated. You showed that in the chart in the beginning of this segment when you showed the infection and the vaccination rates in certain parts of the country. If we really got the overwhelming majority of those 80 million people vaccinated, you would see a dramatic turnaround in the dynamics of the outbreak. So it really is up to us. We have the power to do it. We just need to do it.
So what you're saying is right now we're a victim of our own polarization?
I believe so, Chuck. I've been saying that, and you and I have discussed this on your show multiple times. Yeah. I mean, to me, it just is astounding. We're dealing with a public health crisis, and there's still divisiveness about things like mandating and masks and things like that. Let's crush this outbreak and put those divisiveness and those differences aside.
Yeah, this seems like it shouldn't be that hard to rally people to this message, but it has been very difficult. Dr. Fauci, as always, sir, thank you for coming on and sharing your expertise and perspective with us. Much appreciated when we come back.
Thank you, Chuck.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.